So my name is Rachel Kesse-Adu. I'm a consultant haematologist at Guy's and St. Thomas's Hospital. And in the next 10 minutes, I'm hopefully going to cover the causes of pain in patients with sickle cell disease, as well as briefly touch on the common problems that patients encounter when they seek healthcare. So to start off with, we'll briefly look at the pathophysiology of sickle cell disease. So sickle cell disease results from a single point mutation, and this point mutation replaces one amino acid, glutamic acid, with valine in the beta globin chain of hemoglobin. That single amino acid chain results in the formation of sickle hemoglobin, which unfortunately underlies all of the problems of the condition. Sickle hemoglobin, unlike normal adult hemoglobin, polymerizes when it's deoxygenated. That leads to the formation of sickled red cells, similar to what you can see on the slide. Those sickle cells are not able to navigate blood vessels quite as well as a non-sickled red cell can. They also have a shortened lifespan. The two main things they result in is vasoocclusion, because they block blood vessels, and then they die early, so hemolysis, causing anemia. So the combination of vasoocclusion and anemia results in all of the organ damage that is associated with the sickle condition. And as you can see from this slide, sickle cell affects pretty much every organ in the human body. This slide shows it affects everything from the brain down to the skin, the eyes, the liver. But speaking to patients with the condition, there are two main things they complain about: chronic fatigue, which is associated with the chronic anemia, and the second is pain. So lots of diary studies have been done, and these show that sickle patients spend more than half their days in pain. On the slide you can currently see is a painting by a chap who did have sickle disease, who sadly passed away, and he would normally make these drawings while he was admitted in pain, trying to convey the severity of his pain. And I think this picture does actually convey that really quite well. Pain in sickle cell disease manifests in a number of different ways. Patients can present with acute intermittent episodes of pain, which we will speak about, but they're referred to as sickle crises. Or they can have chronic daily pain due to damage to various bone or organs. Or lastly, they may present with acute pain in someone who has a background of daily chronic pain. It is worth noting that pain in sickle cell spans the whole of the lifespan of a patient, so from childhood straight through to adulthood. So focusing a little bit on the acute sickle pain episodes. So as I said, these are referred to as acute sickle pain episodes or vasoocclusive episodes or sickle cell crises. These episodes are usually sudden in onset. They're completely unpredictable, and you cannot predict the duration of an episode at the start of an episode. So it may last a day or it may last a week. It is really important that when a patient presents with acute sickle pain, they're rapidly assessed and managed appropriately. This diagram tries to show you about what a sickle pain episode looks like. So patients report a prodromal phase, which is when an area where they're about to develop pain might get numb, a bit tingly. Then they have an initiation phase where their pain score will start rising from 0, 1 through to the highest level of pain imaginable. The established phase is when patients are usually admitted into hospital. So this is when they have the worst amount of pain and requiring the most amount of analgesia. The resolution phase is usually when they're being discharged home and what they manage at home before they get back into their normal lives. It is worth noting that patients with sickle disease only present to us on a minimum number of days when they're in acute pain, and they actually manage the vast amount of pain out in the community. So we'll talk a bit about chronic pain now. As I said, sickle patients can live with chronic pain, which is daily pain that they manage their lives around. It doesn't bring them into hospital. And the causes of chronic pain in sickle are many and varied. I will just touch on a few examples of this. One of the most common causes of chronic pain in sickle disease is avascular necrosis. And this can affect a number of bony areas, but most commonly it affects the hip bone. Most people will remember the anterior third of the femoral bone in your thigh bone is supplied by a single blood vessel. If you sickle that blood vessel, you are going to kill off that bit of bone. And that bit of bone is where you carry all your weight. So you can imagine the amount of pain patients will be managing if they're weight bearing through a bit of dead inflamed bone. This is something that can be seen in up to 25% of patients, and in adults it can go up as high as 80% of the population. It presents with pain in their groin, it can present with joint stiffness, it limits mobility and can require significant amount of analgesia to allow patients to be able to navigate normal life. The images on this slide show you the various stages of avascular necrosis. Stage 0 to 1, you can see, is where there is bony infarction, but there is no abnormality to be seen. So this patient will have an entirely normal X-ray. But as you can see, once you get to the latter stages, the bony abnormality is really obvious to be seen. Back pain is also fairly common in sickle disease. Unlike hip pain due to avascular necrosis, which can be treated with surgery and may resolve, back pain in sickle cannot be resolved in the vast majority of patients. They simply have to manage around this pain. And there's a variety of reasons why back pain is a particular issue in sickle, usually because of sickling in the vertebral bones within the back, and because we all have to mobilize and weight bear relating to our back, you can imagine this causes a significant amount of comorbidity in patients. So we'll focus now on how to approach pain management in a patient presenting to you with sickle disease. There is nice guidance on this, which you can see on the slide, and I'm not going to go through, apart from to reiterate, it is very important you treat a patient as an expert in their condition. It is very important you listen to a patient when they present with pain. It is really important you try and follow the analgesia, individualized analgesia plan for sickle patients when they present to you. Regardless of NICE guidance, which has been in existence for more than 10 years, patients presenting with pain still come across lots of issues that are entirely avoidable and not really acceptable. They will have to put up with lots and lots of delay in getting their analgesia. They will either receive too much of a drug or too little of a drug. And they may sometimes be given analgesia that is not at all appropriate for their level of pain. And less frequently than before, but it does still occur, patients are treated and stigmatized for asking for analgesia. Racism affects how sickle patients interact with their healthcare teams, and that cannot be ignored. It exacerbates lots of things that patients come across. It creates a level of stigma that it is really important that healthcare professionals are conscious of and actively work to counteract. So in summary, hopefully what we've covered here has shown you that sickle patients live with pain, and they do so across their lifespan. And that pain may be acute, it may be chronic, or it may be acute on a background of chronic pain. Vaso-occlusive crises account for most acute pain presentations, but there are a multitude of other causes of pain in sickle patients. It is really important that when sickle patients approach us for help with pain management, we regard them as experts in their health condition.